Get more now on those claims from the Red Cross that the NHS is facing a humanitarian crisis. It's prompted the Labour leader, Jeremy Corbyn, to call on the Prime Minister to update MPs on Monday about what she plans to do with the health service.
I'm absolutely shocked at the state of our NHS that a essentially voluntary organisation like the Red Cross feels the need to make this comment and also to give such active support to A&E departments in crisis. This is a wake-up call to properly fund our NHS and properly fund social care so that those who are in a desperate situation but need care outside of hospital are able to get that care. Local authorities don't have the money to do it.
How would you solve the problem?
Immediately we would cancel the corporation tax cuts that the government is proposing. That would help to fund it. We would ask the DCLG, the Communities and Local Government Department, to properly fund local authorities so that the social care factors there can be properly funded. These are priorities that can be done now.
How much extra money is needed and where would you find it?
Well, the cuts that have been made to adult social care should be reversed. That several billions have been made. The cuts that have been made to the NHS budget should also be reversed. And as I said, the majority of that money will be found through corporation tax cuts being reversed.
The NHS's money worries are no secret, but now, according to the Red Cross, a shortage of cash has led to a humanitarian crisis in the health service. It may sound extreme, but Pat and Jeff Nicholson agree after they spent hours at a hospital last week, which they say was dirty and understaffed.
I was so frightened, I just wanted to come home. There was no care, nothing at all. You asked for help, it wasn't there. And you saw other people trying to get out of bed, obviously distressed, and no one to look after them.
Many hospitals admit they're overstretched. Here in Worcestershire, investigations have begun after it's claimed 2 patients died while waiting for treatment on A&E trolleys last week. In many areas, the Red Cross has been drafted in to help. Boss Mike Adamson says humanitarian crises don't only happen in war zones.
The definition of a humanitarian crisis is about a crisis affecting a large number of people for a long period of time. And that's what we are seeing in the health and social care system at the moment. More than 500,000 people who used to get social care support no longer do as a result of the billions of pounds of cuts over the last 5 years in social care funding.
Winter is always busy, but in the last month, A&Es closed their doors to patients more than 140 times, with many urging people to stay away unless it was an emergency. And ambulance services are also feeling the pressure. On the busiest night of the year here in London on New Year's Eve, a computer blackout meant that call handlers had to take details using pen and paper. The government says it's invested billions into transforming the NHS, but opponents want the Prime Minister to do more.
Come to Parliament on Monday, understand the severity of this crisis, understand the very restrained language that's been used by the Red Cross, and act accordingly to ensure that this crisis is dealt with.
Well, let's talk more about this. I'm joined by Dr. Yusuf El-Gengihi, a GP and author of How to Dismantle the NHS in 10 Easy Steps. Thanks very much for your time. You heard what Mr. Corbyn had to say there and how Labour and he would fix the problem by reversing corporation tax. Is that how to fix this?
Yes, absolutely. I think Mr. Corbyn is absolutely correct. In fact, the Labour leadership's the first major political party in a generation to announce that they want to restore the NHS as a publicly provided, publicly funded, publicly run healthcare system as it originally was through the NHS reinstatement bill. And that's been before Parliament. And of course, this current government doesn't want to pass that because the current government's policy is to privatise the NHS, and they're not telling the public that. They're not being honest with them. And what we're seeing now is, of course, this humanitarian crisis in the NHS, shockingly, as the Red Cross has described it. And the responsibility ultimately lies with Jeremy Hunt and with the Prime Minister, Theresa May.
Let's pick up on that, the humanitarian crisis line. Really strong language by the Red Cross. We're more used to hearing that language in response to maybe a Syrian civil war that's killed almost 500,000 people, or an Ebola crisis that killed 10,000 people. Is what's happening in this country really a humanitarian crisis on that kind of scale?
Well, I don't think it's on that kind of scale, but what we are seeing is that the Red Cross over the past few years has been back in Europe for the first time since World War II. That tells you the extent of the crisis, of the effects of austerity and cuts across Europe and the UK. And with regards to the NHS specifically, of course, we've had this terrible tragedy with 3 people dying, 3 patients dying unnecessarily in Worcester. And this is happening, unfortunately, across the country. That patients are dying because hospitals are on red alert, ambulances can't reach life-threatening emergencies, and this is a deliberate crisis. It's a manufactured crisis due to cuts and, particularly importantly, privatisation. I think we've talked quite a lot about cuts, but actually it is privatisation which is the most important thing. It's sucking billions out of the NHS, whether it's privately financed hospitals paying extortionate interest rates in the millions each week on their mortgages, or whether it's the outsourcing and contracting out of NHS services, with the profits going to companies like Virgin and Serco and United Health and going offshore, and they're not even paying the tax on that. They're engaging in tax avoidance on those profits.
Dr. Elgin-Gehi, a topic that deserves much more time, but thank you very much indeed for explaining what you think about this situation. Really appreciate it.
Thank you.